Hello and welcome. My name is Andrea Bell, and I am a 2013 graduate of Stony Brook's Dental Anesthesia Residency program. My current position is Clinical Assistant Professor at Temple University's Kornberg School of Dentistry, where I teach dental students, residents in the field of periodontology and pedodontics. I'll start by saying one of my favorite things to say, which is that I came to Stony Brook as a good dentist, but Stony Brook made me a doctor. Whether it's from our experience that we get in the recovery room, which was one of my favorite rotations, or just rotating through private practices, pre-operative testing, all those things, I can say that nothing was a waste of time. Everything is going to be what you make of it. Whether you go to Stony Brook or anywhere else, everything's going to be what you make of it. But Stony Brook definitely prepares you for what you're going to see when you get out here in the real world. And things as simple as just knowing how to communicate with a patient. Our patients come in and they're afraid, they're children, they have special needs, and all the attendings there will get you prepared where you know how to have that conversation with them. Those conversations can be tough sometimes, and you will definitely be prepared for that. Like I said, the recovery room was one of my favorite rotations, and that is just because you got to see some of everything. You got to really learn how to manage pain. You got to learn how to manage a ton of staff because you have a ton of nurses, and you get to draw from their wealth of experience, which is phenomenal. Pre-admission testing was also an excellent rotation. Everyone there was very welcoming, and you got to see just a ton of different things, and it lets you know what you do and do not need when you're doing your own preoperative assessment. So that was helpful. If something is if you see criteria that you don't need in a hospital setting, then you likely don't need that in private practice. So it just kind of brought things home. I think when I first got there, I thought I needed all this information. I need a consultation from this doctor, that doctor, cardiologist, endocrinologist. And I'm not saying you don't need those things sometimes, but it just helps to fine tune you as a doctor so that you can make your own assessments and, really know the things that you definitely need to get and the things that you can evaluate on your own. Say rotations in private practices prepared me for when I was in private practice, because you have to make your dentist happy, and you also have to make the patients and their families happy, and most of all, you have to keep that patient safe, and that kind of spreads across private practice. Me and being a faculty member, anywhere you go, patient safety is foremost, and you will get that at Stony Brook. You'll see patients ages all over the place, from infants all the way up to 80, 90, and those are patients you'll see in private practice sometimes, not only in the ORs at the hospital. So you're definitely prepared. You also get a good feel for different practices in anesthesia. So there are a lot of attendings, especially at the hospital, and you'll get to see a ton of different ways to do things, a ton of ways to manage an airway, and you'll get really good at airway management, which is paramount. My biggest, emergency, you'd call it, that I've had in private practice was my previous position as a faculty member in the outpatient setting, and we just had a patient who just had a very difficult airway to manage, and we were able to kind of just go through the algorithm, which you'll learn inside and out, and manage him, and the patient did just fine. But it's frightening. It is. This stuff is scary. This is someone's life, and you will get good at learning to manage those things. Staying calm, staying relaxed, just being the person in control of the room. I just can't stress that enough, that you're going to be the person that everyone's going to be looking at, and you just want to make sure you're presenting yourself in a great way, and Stony Brook definitely prepares you to do that. I have had the opportunity of working with other dental anesthesiologists, some who have been in the field for, decades. And I'm not saying that I am, any way smarter or whatever than they are, but it's just a preparation thing. When you know your stuff, and you're prepared, and you're just ready for whatever the patient may throw at you, so you present yourself in that way. And I think that does make a huge difference when you're dealing with, again, parents who are nervous, kids who are nervous, a practitioner who may be nervous about having anesthesia services being provided in their office. So you will be prepared. The rotations, again, that meant the most to me. Again, recovery room and pre-admission testing. I think those were the most helpful. We do have an excellent, well, at least we had an excellent rotation in pediatrics, which was off-site and very strong clinical basis, and that was very, very helpful, especially in kind of every role I've had since leaving residency. I've dealt with a lot of children, so that helped a lot in terms of assessing and knowing, again, what's important and what's not so important. But yeah, congratulations, and this is a huge step. I'm very thankful that you're even considering Stony Brook, but just know that this is a great, great place to learn. It's a great, great place to grow as a doctor, and I wish you the best of luck. My contact information is out there. If you ever have any questions or anything, just feel free to get in touch with me. Dr. Epstein knows where to find me. Again, congratulations and good luck.